Excuse me, I will take 5 minutes, just it's prayer time here. I will pray and we come back.
Yes, ma'am.
Good evening, sir.
Good evening.
Good evening, Father.
Good evening. Good evening.
Good evening, Father.
Very good evening, Pooja. Yes. Just type in some messages in the YouTube kind of space, comment space.
Good evening,
Type in some
Father.
messages. Yeah. I request you all to sign in and go to the YouTube comment space and put some messages. We'll begin in 2 minutes.
Good evening, Father.
Very good evening.
Good evening, Father. Good evening, Father.
Good evening, baby.
Good evening, Father.
Good evening. Good evening. Good evening, Junior Ranjini. And good morning and good evening together. Yes. Hello. Yeah. Thank you, Mrs. Everest, for the super chat.
Good evening, Father.
Good evening. Are you all there at YouTube? Just type in. Chat it is just 8. We have reached 30. Thank you for all the crown super chats. Any Varghese, Varsha, Mrs. Everest. Yes. Yeah. Friends, could you post the link to in all the subgroups?
Okay, Father.
Please do not post anything now, okay, in the main platform, evaluations and other things. Yeah, good evening, everyone. Just type in where are you from at YouTube comment space. Let me know where are you from, which country, which nation, so we know your timings. You could post the timings as well, it is cool. So that others get to know the timings. Yeah. Yeah, beginning in 2 minutes. Some have gone for prayer. They'll be back in 2 minutes. So by the meantime, if you have any concerns, either those who are at Zoom classroom can speak out, and those who are at YouTube Live can type in your concerns. Yes. At the same time, keep chatting in the YouTube comment space. I can't access Zoom classroom chat space as I'm sharing the screen with the live. Yes. No smiles? All are tired. Edu Skills discussion group people are tired after discussion.
No, Father.
Grab some tea, coffee, some snacks for the way. As I said, it all depends on your energy, how far we go. Yeah. I request all of you to just click on to YouTube Live button and just post your comments there. Thank you, Chandra Vadhani. Thank you, Chandra Vadhani, for the super chat. Thank you for your support. And that will help us to reach more people. Please sign in to YouTube as well. You can just click on even from the same instrument, or if you have a second instrument, you can click on the link, YouTube link. Yes. Great. How did you feel about the previous session? You have any concerns or you found somewhere challenging? I can sort it out today if you tell me. Yes, Salafa, good evening. We were waiting for you.
Good evening. I'm
Yeah.
sorry for being late.
It's okay, no problem.
Did you feel about the previous session?
Yeah.
Any concerns or you found somewhere challenging? I
Second
can sort it out today if you tell me.
lower
yeah.
the
It's
lower
me.
the volume.
Yes.
Yes, okay, it's okay. Yeah. Chat rate is just 60. 30 is our chat rate to begin. Just chat in the YouTube comment space so that we start. As soon as it is 30, we will start. It is 16 now. Right. $24. 6 more. Yeah. Don't stop. Keep chatting. Yes. Dr. Salafa, people are in. Yeah, people.
Yeah,
Yeah.
part of them, they were in.
Yeah.
They send reminder for them.
Yeah. Any concerns? Did you have any concerns in the group? Since I cannot read the language.
Yeah, actually,
yeah.
we were discussing the the difference between ISPER and the thematic method. Because we tried to write the last task according to ISPER, some of us wrote it according to thematic. We hope we can clarify this point.
Yeah, then maybe after this session, the upcoming sessions, we'll focus on ISBAR. Once we are thorough with the case notes and how to frame sentences and how to make paragraphs, then it's only keeping the order of the paragraph. That's the only difference. That I'll show you at the last session. Like I will just pick the order of the paragraph and tell you, depending on what situation, how should it be. That's all. There is nothing special. There is no other change. The order will be little changed. That's all. That will put it clearly. And yeah, certain things you do not go too deep into discussions. They are very simple, which will give you in simple terms. Yeah, and by the meantime, just could you type in all those who are here? Are you a beginner? If you're a beginner, just type in B or beginner. Even B will do, so that I have an idea whom I am speaking to. Keep smiling. Those who cannot on the video, send me some smileys in the YouTube comment space. Since I can't see your smiles, you can send some emojis. Yes. Please mute. Yeah. It's cool. Yeah. Kids should be there. Yes. Still chat rate has not reached. All of you, could you just send some messages at YouTube chat rate? Usually we start whenever we reach 30. Chat rate 30 is 27. Yes. Thank you. And all can send it.
It will take 5 minutes, just it's prayer time.
Sorry?
No. This is the previous
Okay, cool.
record. Yeah,
Okay.
I opened the third instrument. This is
Okay,
why.
okay, no problem. Yeah, okay. Good evening. Yes, mute your audio and try to switch on the video sessions. Okay. Yeah. All those who are willing to and allowed to switch on your videos, you can. Otherwise, you are exempted. Usually, our platform doesn't allow. Since this is specifically for your group, we understand your cultural problems, so it's cool. But I will be energized with your smile if you can smile at me. That's the signature and strength of this platform. Yes. And any other concerns? Others, if you have any difficulty, if you tell me, I will customize accordingly. As I go on, I can add those points in a particular place where we reach. All these case notes are given by Dr. Salafa. As I said, today is doctors, medicine, writing, but then as I mentioned, if you don't require 500, it is okay. For everybody, it is applicable. Till 450 marks, it's applicable. Certain differences, I'll tell you. As I go on, I'll mention what is different for nurses. For example, doctors will use first person, but nurses cannot use first person. For example, I prescribed paracetamol for a week. Doctors later will say, I prescribed, but nurses will say, paracetamol was prescribed.
Mm.
That's all.
They
Yeah,
write
that's
in
a
a basket.
minor. Yeah, those are the minor differences which I will be explaining as well. Don't worry. No doubts, right? All are experts. Yeah. How is Dr. Salaf? How is it going in the group? Are they
Yeah,
confident?
yes, they are good. And also we have extra discussions with our colleague Saleen. She's conducting writing sessions also on Sunday and Thursday. She's with us here. We join her usually and we write case note and discuss it. So we are doing much of that.
No, go as per the steps. That will help you a lot.
Yeah.
If I like, no, today I'll be showing you for advanced people. For you, I have segregated 21 steps into 10 steps. I have summarized it.
Yeah.
And basically, we will be going step by step. We will not be taking all the case notes into transforming into sentences, but a couple of them, specimen purpose, rest will be homework. But then to get an idea, clear idea.
Okay.
The major issue is using, and the last time somebody asked me about grammar that we'll be dealing with. I'll exactly tell you what all things which should be used for what type of case notes. There are just 4 types of grammar tenses you have to use, nothing else.
Yeah. And recently I watched a lecture about how to use Grammarly. I posted this in the group. Yes, it is very useful. Now they are started using Grammarly.
Yeah,
and,
it's useful. Yeah.
Yeah, good. Yes.
Yeah. With Grammarly and in the last, after a couple of sessions, we will tell you, because after learning all these things, self-correction strategies, around 40 self-correction strategies. If you correct your own letter with those strategies, for example, have you made this mistake, every mistake I'll identify at every line. And if you cross-check those 40 aspects, definitely you can get 450 plus. You need not go to any teacher for correction.
And
You'll
do you
be
recommend
self-reliant.
ChatGPT, Faza? Is it okay for
Pardon?
correct ChatGPT?
Yeah, ChatGPT you can use. Yeah, you can use. But then your ChatGPT sometimes makes mistakes. You should be cautious about it. You can blindly believe it because ChatGPT confuses sometimes. If your prompt is not correct, it will give you something different. Prompt must be correct. If the prompt is correct, most of the time it will give right.
Yeah. Okay.
Yeah. But then these basic things, whatever we do, like ChatGPT can give us, but knowledge, but not the skill. So what we have to go step by step and develop the skill of writing the sentences. And as you practice writing, today I'll show you how it's going to help your reading, listening, and speaking as well. It helps. All the 4 subtypes are interlinked.
Okay.
Did you watch the previous video? Those who did not attend, I just want to know so that I know the background. So I need not touch upon those things. If you can just type in the YouTube comment space, just give a thumbs up if you have attended or watched the previous sessions. Either attended or watched previous sessions. Just give a thumbs up or say yes, so that I know if majority have attended, I can skip certain areas because you might know those things, so that we can make it shorter. Yes, 10%. Yeah. Chat rate is just 9. Yeah, yes. Attended, yeah, just thumbs up will do. If only one session attended or one video watched, just say 1. Either attended or watched that school. Previous videos, yes. 1 means 1, 2, yes means 2. Yes, 1. Okay. Okay. 1 attended, okay. Previous session, yes. Yes. Now, most of you have attended, I believe. From Dr. Salafa's group, majority might have attended or watched the video, right? I think I
Yeah.
have given a notice. So let's begin with a minute silent file. Good evening, good afternoon, good morning, wherever you are from. Have a nice time. I know some of you are at the early hours of the day, 4:30 and 3 o'clock and 6 o'clock. And some of you are at the evening. And all are welcome. Have a nice time. Let's enjoy this. It's going to be very interactive and interesting. Let's make it interesting together. I request all of you to just join us at YouTube as well, so that we will interact over there. This mice, okay, in OET. Cool, don't worry. Yeah, you'll have to, I can just see the chats here just flashing on my screen. I cannot read now. Somebody posted something I could see only. Yeah, I know, some 7 attempts. It's cool. Attempts doesn't matter, but have patience. And I can challenge you, take patience and go step by step. And if you're not sure, if you have time, 4 or 5 months time, as I recently posted Zoe's video, because mainly that is the thing. That's why I was posting it again. You remember Zoe's video? She was telling she took it from the very beginning. So in the very first attempt, she could get it. So even if you are repeaters we consider as pre-beginners. Beginners don't have wrong learnings, so they learn what we say. But then those who have attempted several times will have wrong learnings, wrong way of practicing things. So we'll have to correct those ways and then learn the new things. That's cool. But then if you have time, we are planning maybe next batch from scratch. We have also created a new YouTube channel for it, so that there is no confusion. Everybody is messaging me saying confusion. And I'm handicapped with my WhatsApp getting restricted because of many reports and other things. Again, I'm getting a warning. And the tech team has said, probably I will not have my WhatsApp number because they are sensing something wrong. It's not wrong because there's a consolidated effort reporting by some people saying it's a spam group. So anyhow, that's all part of it. Anyhow, we'll be going. You can let us know if you want to go from the beginning. Maybe maximum 15 to 30 minutes a day. We have said 15 minutes a day and 1 session in a week. That's more than enough from scratch. Or those who really find it difficult, if you have at least 5 months. Otherwise, you cannot go with that batch. That's for the beginners and those who are really, those who need from the basics. Yes. So today we are having medicine writing, a beautiful case note. And maybe one more hit you have to hit at the YouTube comment space. Its chat rate is just 10. Yeah. When you hit the chat rate, the participants number increased by 30% at the YouTube. The more you chat, more people reach there. That helps us. Madhushri, thank you for your super chat. Yeah, somebody was asking what is super chat. Super chat is something that you support us to reach more people, it starts with the Indian rupees 10. So that you can, near the chat message box, there is a dollar icon. You can click on it. If you pay 10 rupees, you get a crown, and always with the message, that crown will be seen as you see in the messages in the. Yeah, it's more than just Indian 10 rupees. It's like we reach more people. That's the advantage. Yeah, so all those who can afford can just spend 10 rupees or 20 rupees and get one super chat. Those who have not tried, just try, okay? It's very easy. Yeah, it's also a way of supporting us. Yes. Thank you. Still the chat rate is on 10. Don't stop when you chat, keep chatting. Everybody, yes, just 2 minutes, please, if you can afford. Yeah, Salapa, thank you. Salapa is saying if you can afford, buy a super chat. Only those who are working, those who are not working and who cannot afford, please don't try. Don't worry, okay? Yeah, only those who can afford. Yeah, it starts from, that's what I came to know from the participants here, because this is arranged by the tech team, because they are finding difficult to manage the platform, that's why. Yeah, because, the number of aspirants are very less now, where we had always house full. So it's there and go together. Yes, thank you. 25, chat is 25. Yes. Okay. Hope it will get in. Focus mode is not on, right? In the YouTube admins.
Yes, Father.
Not on. I have put it
Not
on.
on.
But
Not.
Ignore it. Short film. Horror short film.
sorry. Why focus mode?
It showed here focus mode is ending.
Yeah, it was in focus mode. I am just checking why it did not appear. Focus mode. I am trying again. Okay. Yeah. Now it must be, I believe. It will take a couple of seconds to reach there. Let me know if it's cool. Not at right? Yes. Fine.
Yes,
So once again, yeah, those who join now, good evening, good afternoon, good morning. Yeah, if you're feeling sleepy, have some tea or coffee with you. So we cherish our session. Let me share the screen. Yeah. One second. Yes. Is the screen visible at YouTube?
Yes.
Not yet in YouTube.
Not yet. Not yet. Yeah. Yeah, it's coming.
Yes, just now.
So sample test for Mr. Adam Knowles. Okay. Yeah. So specifically for medicine, but it can be irrespective of medicine, profession, all can benefit from the session. Yeah, there is no much difference. So how many of you have written this letter? I got very few letters this time. Just type in if you have written the thumbs up or yes, just so that I know you have the idea fast. Yeah. Within those things, responses should be within seconds so that we can go very fast. So I have an idea, I see. Okay, Mr. Everest, thank you. Mr. Everest, again, thank you so much for your super chat. Yes. Since others are not doing it, she has done it second time. Yes. Cool. Okay. Let me know whether this mode is better or I have some problem with my laptop, or this mode is better. Which is better for YouTube people? Okay. Now I'm playing full screen.
On YouTube, it is not there, Father.
No.
No, Father.
No, it is the visible.
Okay. Full screen is visible, right?
It's visible, but in YouTube, it is not showing.
Yeah, now is full screen.
Okay. Thank you. That's better because those who are using phone, it will be difficult.
Yeah.
So I have summarized for the advanced people. I have summarized the 21 steps into 10 steps of OET writing. Identify the relevant, semi-relevant, irrelevant case notes. Transform each case note into a simple sentence. Transform case notes into compound sentences. Transform case note into complex sentences. Write a story. Speak out about the patient. Write or speak out. Segregate the case notes. Sentences based on the key issues. Arrange the sentences points according to sequence, cohesion. But then writing paragraphs. It can be either chronological, thematic, issue-based. Both the ways at school will teach you. 9th one, start writing the letter in the writing format. You know the format. We are going into it. Mistakes to be avoided in OET writing and self-correction strategies. Okay. So format you already know. I'm not going to explain it because majority have attended the session or watched the video. Address, date, tray line, purpose, body para 2 or body para 2, 3, request. And this is what being assessed, 180 to 200 words, the body of the letter. Okay. Now paragraphs, purpose paragraph, the reason for writing. Purpose, why are you writing? That must be there. That's what we call the reason. Purpose is immediately apparent. Immediately apparent means very evident why you are writing, which means the reader will know what he should do. Body paragraph 1 will speak about.
I thought you like paused it and like you took the easier side because you got scared. So like that would like ruin this thing. That's why I said like.
Excuse me, could you mute?
Okay, if you like don't pause it again. If you pause it again, I'll just be quiet. Okay?
And don't scribble on my screen if you are not familiar with the things. Please don't touch the screen. Okay, someone is scribbling on the screen. Okay, paragraph 1, current situation. Once you know this thing, what speaks about current situation in the case notes. Body paragraph 2, background to the situation. You can just write down this. Okay, paragraph 2, body paragraph 2. Just you can write simple purpose 1, 2, B1, B2. So that when we look into the case note, you can identify easily what is it. Body paragraph 3, relevant history. Closing request, speaking about the next steps, what is to be done. Okay. So in body paragraph 1, whatever you come across about the current situation of the patient, you will write in the body paragraph. Because the letter is...
Does this include examination findings and so forth in the current situation?
One sec. I'm coming. Please, somebody is scribbling on. I'm coming back. Please don't scribble on the screen. Please don't allow the children to touch the screen. Okay. Yeah, that will be a disturbance. Yeah, it depends on the situation. What examinations concerning what issue, depending on your purpose, if it is relevant. That I'll be showing you as we go on. Because we cannot say all those examination results will be included. If they are not of this particular purpose, reason, that will not be included. Otherwise, it will be included. Then background to the situation, body paragraph. Current situation is this. See, this is a simple logic. Now, what happened? She is in the ICU. Imagine you are asking about somebody who met with an accident. What happened to her? She's in the ICU. Then you will ask, what happened? How it happened? What was the situation?
Yes.
Present current situation and background to the situation. How she came to the ICU, why she came to the ICU, background to the situation. Then relevant history. Maybe you say somebody suddenly collapsed in the hospital, where a nurse collapsed, a doctor collapsed, or somebody collapsed in the hospital as they were doing their duty, and they are admitted, they are serious, they are in the ICU. Now you will ask, what happened? Where it happened, when it happened, all those details. Then Okay, he had an issue with, he had epilepsy, or she had epilepsy, or she had some other issues. That is called relevant history, connected to this situation. History that is relevant. That's the important word. Not all the history given. Relevant history, which is connected to this particular
situation
or the purpose of the paragraph. Then, next steps, what is to be done. As simple as that. Provided you know how to form sentences. Okay.
Yes.
Step 1, understanding OET writing task means learn how examiners expect doctors to think before they write. How should they think? So they are looking into certain things. First one, read the case notes, reading the case note efficiently. Are you able to, your ability to read the case notes efficiently. Second one, understanding the reader. Who is the reader? Third one, understanding the purpose of the letter. Then identifying the writing task, understanding professional communication, and avoiding information overload. Don't overload the letter with informations which are not necessary or which are not relevant. These are the things what we look into. And identifying the key issues, as I said, primary issue, secondary issue, then relevant background, and irrelevant information has to be segregated. We will be coming to it. Now, maybe coming to case note. Are you able to read this? Those who are using the phone, I have put into 2 columns. Is it readable to YouTube?
Yes. Readable.
Yes. Okay. Now, first thing, as soon as you get the case note, if you have the case note, have it in your hand, hard copy if you have, what you have to do? Maybe I will take the Word format, because when I put it in escape full screen mode. Sorry. Yeah, this will not be seen. 1 second. Have it here, Word format is. Yeah, this is the case note. I will share once again so that you can see it in the Word format. Yes. Is the new screen visible? The Word document.
Visible.
Yeah.
It will take a couple of seconds at YouTube.
Now visible. The YouTube.
Visible, Father.
Okay. Let me look at the distractions. Yeah. Now, what you have to do first, let me know. You can put it in the YouTube comment space. Those who are at YouTube first.
Check the date and then you go to the task.
Go to the last task.
Yeah. That is one thing, but why don't we just know who are you first?
Yeah, know your
Yeah?
role. The case
Yeah,
is.
know your role first. You are a doctor in a city clinic. Mr. Knowles is a new patient in your surgery. First step, let us know who you are, who is writing the letter. Okay?
Yes.
There will be mentioned who is writing the letter, who you are. Your designation is given by the case note. You may be a different person, you have a different designation, but you aren't that designation here. Then immediately go to the last portion. Last portion means?
Task. The
Writing task. Yeah, just to put number 2 here, okay? Using the information given in the case notes, write a letter of referral. So, it is a referral letter, type of letter, to Dr. Desai, a gastroenterologist at the city hospital for assessment of Mr. Knowles. Address the letter to Dr. Desai from city hospital as well. Okay, address is there. Those things are there. Then where you have to go? Third step.
Purpose.
No, third step, you go just above it.
Yes.
Here it is plan. Whatever is given just above the writing task. Third step. Then only you will be able to understand the purpose. Now here it is read, it's a referral letter to gastroenterologist. You have an idea what person is, but you don't know why you are writing, right?
Yes.
So you have to go just above the writing task. Here it is given under plan. Whatever, just above the writing task, that is number 3. You can, in the circle, you can put number 3. Here, urgent referral. This is important. Urgent referral. Okay. To gastroenterologist for assessment and endoscopy. Okay.
Yes.
For suspected
Pancreatic
malignancy. Patient aware of the possibility. Patient knows there is an issue like this. Doctors already, you have already told the patient. We are doubting, suspecting pancreatic malignancy. That information will help the reader. Otherwise, he will be wondering, should I tell him or not? Like those. To get the details, he can openly get the details. Now, here, what is these two, whatever I highlighted just now, this is very important. For which paragraphs can anybody tell me?
purpose.
The first
and-
paragraph.
Yeah.
First paragraph.
Yeah. First paragraph and fifth paragraph, both. Okay. First and
Yes.
fifth paragraph.
Yeah.
Because in the request also you have to say what is to be done, right?
Yes.
Assessment. Yeah. So first and fifth paragraph. This information is for first and last paragraph. Request, whatever the paragraph number you have, request paragraph. So it's very clear for you from where you get the case notes for your purpose paragraph and the request, final request. Then where you have to go?
You can go from back to present.
Yeah.
Patient
Now,
details.
yeah. Yeah. What you have written there? Next paragraph.
Purpose expanded.
Yeah.
We should write the expansion of the purpose.
No. What I am saying, I have given you first purpose paragraph reason
Keep
for
it
writing.
there. Bro, keep the cursor away again.
Sorry. So if I could
Bro, stop.
just
Go like 3 seconds back.
instruct them not to mute. Yeah. Please mute. Okay. If you are not interacting here, please mute so there is no distraction. Okay. Sometimes we are newcomers. We understand. We don't know what is mute and unmute. Yeah. And host can mute them. Okay. Click. If you can see them, you can just click on those 3 dots and mute. And now what is the next step? Current situation, right?
Current situation, yeah.
We have written down. So where will be current situation?
In the last visit.
From the last
Yeah,
visit.
last visit. So it must be here, right? This area. So from here, we are going from backwards. Even earlier, I told you in the previous session, we can save a lot of time. So what is important here? To understand correct situation?
No,
Date.
Main concern is back pain.
Back pain, okay. Main concern is back pain. Then,
New symptoms.
New symptoms.
okay, new symptoms. Fatigue.
Weight loss, yeah.
Yeah, weight loss, there is some mistake, okay. Here it should be, arrow should be there, okay. Just, I will not be putting now, yeah. Then,
Examination.
Examination. Abdominal tender.
jaundice, yellow discoloration of the skin and eyes.
we have to find out that man who is not muting. That means just check out. Maybe some spammers can remove them. Then pathology report, is it important to understand the current situation?
Yes.
Yeah.
Yeah, all this is important because to understand the current situation, you should know all those details, right? All those test results. Now it's very important here to understand the current situation. These results are very important. Dr. Salaf asked me this one, right?
Yes,
but then the previous reports may not be, test results may not be important, depending on the connection to the purpose. Then coming to the previous, 2nd August 2019. Yeah,
Yes.
heartburn.
The initial symptoms, yes.
Yeah,
Not relieved by OTCs also, I think.
here
Oh,
anything object?
OTC
Antacids?
ineffective, is it relevant?
Which one?
OTCs
Over-the-counter.
Over the
ineffective.
counter
What
antacid.
is the antacids? We'll keep in a different color.
Mm.
Yeah, you can use it as ineffective is given there, so it is relevant. Yeah,
Yes.
ineffective, yes.
Mm.
Then patient concerned is not relevant, right? Is a concern, nothing to do with us.
Yeah. His initial weight, I think we can
Examination
compare
subject.
it to the last.
Weight also, I think.
Yeah.
Weight,
Initial weight, yes.
okay. Then
Maybe omeprazole,
Control.
although it was proven ineffective, maybe.
okay,
The same,
Yeah.
yeah.
yeah, that's key. Coming back to medication and started as right? Family
Yes.
history, no, not there. Nothing is there.
Okay, yes.
Medical background, childhood eczema,
Gallbladder removal.
Required.
do you
Eczema is
require it?
Yes.
No,
Gallbladder. Yes.
gallbladder.
Yes.
Eczema is not required, Faza. Only the
Yeah,
gallbladder.
Yeah, this is not required because childhood, no?
All that
We'll check. We'll check.
blood
We'll check.
count and liver
Yes, we have.
function test.
Depression
We
is
have a
required.
hmm?
Depression.
Fluoxetine for depression. Is
Past
it?
4 years. History of depression past 4 years. Is it required? Not required.
Not
No,
required.
It is all.
Do you require for this particular purpose? For this
No, it is all the
person?
information.
Medication. Name the medication is required, I think.
Which one?
Fluoxetine.
Yes. Anything else? Think
The
as
blood
well.
count and liver function test.
Hmm?
Social background.
Social
Exam.
Yeah.
background. Married or unmarried?
No
Not
need. No
No
need.
need.
No need.
No need.
Retire management. No need.
Retired, recently retired management.
No
Semi-relevant. You can keep it if need be. Yes, semi-relevant. Physically active plays tennis.
No need.
Yes, he
Dog
was
walking.
No
physically
need.
active.
Non-smoker for past 10 years.
Not necessary.
Social drinker.
I think this one.
Needed. Needed.
Not required, right?
Not required.
Okay.
How about full blood count and liver function test?
Carcinoma is required.
I think
Under
the father.
objective
Which one?
examination.
Sorry, I
Father,
didn't
the
get you.
alcohol and smoking history is not relevant.
I think it's
Smoking as a non-smoker for past 10 years. Means it is on in the initial social background.
As a risk
Past 10 years.
factor, because smoking is a universal risk
Smoking,
factor for cancer.
I think social drinker
Alcohol
also
consumption also
relevant.
is related to pancreatic problems.
Connected to pancreatic.
Yes.
Yeah.
We'll keep in a different color. We'll check out as it goes the whole picture. As we come with the paragraph, we will get it clearly. Okay. But I think it's not going to be very relevant as of. Yes, please.
How about blood count and liver function under the objective examination?
Objective examination.
All that full blood count and liver function test.
NAD. This
Yes,
one
sir.
ordered. We have BC. Liver function test ordered. Ordered, but there is nothing is given, right? No result is given.
Yes, already the result is expressed in the next visit.
Is it
So
given?
no need
The next
to
visit.
mention. Yeah, the next visit. This is the result of the liver function. I believe no need to mention we have ordered. Just we will mention the result.
No, in the next visit, which is the result of this FBC, liver functions test. These are the results.
Yeah, ALT, albumin, alkaline phosphatase,
Here, okay.
bilirubin. This
Okay,
is
we
the
have kept it on semi-relevant. Okay. because it is understood.
Yeah.
When you say these details, it is understood. Doctor knows that's the result of a
Liver function.
liver function test. So
I believe it's
I have put it in a different. I have put it in a different color. If it is known to if the doctor can understand these are the results of that test, you need not again write there is a test was conducted, right?
Yes, yes.
Yeah. So
I believe in the visit of 30 August, we need to mention the yellow discoloration of skin and eyes. Jaundice.
where is it? Yellow this is important. It's
sign of malignancy.
jaundice is, that's important. And for example, X-ray revealed fracture in the hands. Then you need not write X-ray was ordered, right?
Yeah.
Yeah.
Yes.
So that is cool. So this is clear. Let's get back to the business. Yeah. Now, yes. You should be able to distinguish between, there are so many conditions or problems given in this particular case note. Now you should be able to distinguish between primary problem, then other conditions are supporting evidences. There are so many conditions mentioned, like jaundice and other things. You need not worry. They are the supporting evidence. Then what is the referral objective? This is the crux of any letter. If you are able to distinguish what is the primary problem. What is the primary problem here?
Malignancy.
Yeah, pancreatic malignancy. And the supporting evidence, all other things, whatever is relevant, other conditions are supporting evidences. Then referral objective. Those are the things you should know. Then key clinical issue, the major problem. Which is the major problem now? These are mentioned in the case note.
Yes, the major problem.
Which is the major problem? Number 4.
Yes.
Other things are supporting evidences.
Yes.
Which leads us to suspect this pancreatic malignancy. Okay, just the sequence. Every finding contributes. Weight loss. Is it important?
Yes.
Yes.
Yeah. Jaundice.
Important.
Yes. Important.
Yes, red flag means very, very important, most important. Pale stools.
Important.
Yes.
Biliary obstruction. Back pain.
Important.
Yes.
Pancreatic cancer symptom. High bilirubin.
Yes.
Obstructive jaundice. And high amylase. Pancreatic involvement. Fatigue.
Yes, important.
Constitutional symptom. So you should be able to identify these things when you see in that. You are all doctors who are writing this letter. Definitely you should know what does this mean, indicate. Okay. What does each finding indicate? Okay. Now, when you read the writing task, as I said, first we will see who are we. Then we go to the writing task. What you have to know. Now here, if you summarize this, what will be the thing? How do you summarize this? What I have highlighted?
Yeah.
I'm writing.
How do you summarize? Can you summarize in one sentence? Just write down.
YouTube.
Yeah. In one sentence, using those highlighted, green colored expressions or phrases. Can you write one sentence?
Yeah, I'm writing a referral letter to Dr. Desi for the assessment and for evaluate the.
Okay, that's great. Assessment and endoscopy. Then I should have highlighted pancreatic malignancy as well. I did not do it. I should have highlighted it. If you include that as well. I'm showing this because in the purpose paragraph, many people lose their marks because they don't write exactly. They write, he needs immediate assessment. For what? That's most important thing. And I see majority of the letters say so-and-so, and you need not mention I am writing a referral letter. You can just mention.
I am writing to request.
I am writing to, or thanks for accepting, or whatever. Anything you can write, no problem. But then you need not write referral letter because you are writing to the person directly. I am writing to refer this person For your, don't write, just.
For your urgent assessment.
No, some people write like this. I'm writing this letter to refer. No, Mr. Knowles.
Whose?
Who
We can write.
is suspected of
Yeah.
pancreatic
Pancreatic
malignancy
malignancy.
for your urgent assessment. Not enough. Not enough.
But I
And
can
endoscopy.
write.
Your journey is auto journey.
Yeah. I am
Assessment
writing
assessment and endoscopy not enough.
For me,
Assessment and
there's no
endoscopy is not enough. Assessment and endoscopy of pancreatic, suspected pancreatic malignancy. That has to be clearly mentioned. See,
Yeah.
refer Mr. Knowles to Dr. Dev Desai for assessment and endoscopy. Okay? What to do? Refer to whom? Who is referred? Mr. Knowles. To whom? To Dr. Desai. Why? Why? For assessment
Urgent
and
assessment and
endoscopy.
endoscopy.
With that, you have to write pancreatic malignancy. Suspected pancreatic. That when we develop, we will show you. That is very, very important. See why you are referring for assessment and endoscopy of what? Suspected.
Pancreatic
malignancy.
Yeah. Immediately ask why is the patient being referred?
For
Okay.
assessment and endoscopy.
Yeah, for assessment and endoscopy. Because of suspected pancreatic malignancy requiring urgent specialist assessment.
Yes, the goal.
If you ask why is the patient Mr. Knowles being referred, the answer is because of suspected pancreatic malignancy requiring urgent specialist assessment.
Yes.
That information must be there in your purpose paragraph. Do you understand?
Yes.
Most of the people, you lose one concept. They say immediate assessment and endoscopy. Of what? You are sending it because we suspect pancreatic malignancy. That has to be given. Central theme of the entire letter. If you miss it, purpose is lost. Okay? That is the central theme of the entire letter. This you have to understand before you start writing the letter. Okay? And somebody was saying there is no time to make all the columns during the exam. Don't go to make columns during the exam, okay? It's not for exam. This is to develop the skill. In the exam, you may not require anything. As you go on reading the case note, you will understand. This is purpose paragraph. Here it is first paragraph. Here it is second paragraph. Here is third paragraph. And I'll teach you exactly the paragraph structure. Yes. Selecting relevant case notes. Conciseness and clarity is one of the criteria. Okay. And Dr. Salafas one doubt last time was that. We'll be clarifying it now. Okay. Now we will make one exercise. Just make 3 columns. Did you write down the central theme? If you have not done, please write down this central theme of the entire letter. Because of suspected pancreatic malignancy requiring urgent specialist assessment. Write it down on your notebook and smile. Circle it, underline it, and smile at it 7 times. Done? And when as you listen to the session, try writing down, okay, whatever it gets into your brain. That helps a lot of developing your skill. Okay?
Yes.
Yeah. Whatever you can write down, maybe rough. Then later, if you want to make fair, you can make it, or you can revisit, rewatch this recording of the session and fill the things, even if you don't get something. So here, in the page, make 3 columns: most relevant, semi-relevant, and irrelevant. Irrelevant means not relevant. You can understand, write as not relevant also. This is the crux of your score. If you miss any 1 point from the most relevant, your score will go down. If you add anything irrelevant, any case note which is not relevant, your score will go down. You will be penalized. And if you add semi-relevant and your letter goes beyond 200 words, you will be penalized. But if you don't go beyond, even if you add semi-relevant, if you have not missed any most relevant case notes, you will not be penalized. So should I add semi-relevant? What is the answer to the question?
If I'm in shortage of count, I can
Yeah,
add.
if you need a word count, you are running just into 150 words or so, and you want a little more words, you can add semi-relevant, provided you have used all the relevant case notes, then you will not be penalized. But if you are going beyond 180, 190, then you explain all these semi-relevant things, you will be penalized. But usually the relevant case notes will be more than enough to present the case. Now I want you to write down, you can shout out as well, each case note in which column it goes. Omeprazole trial.
This could be
Semi-relevant.
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 Yeah, right. I can't type here because I'll have to reduce the size of the screen. I can't write, so you write in your columns, okay? Later you can find out.
Okay.
If somebody has an objection, you can say, no, this is irrelevant. You can write in your columns. I'll show you the correct thing later. Then you can do the assessment. Then next one, past.
Relevant.
Cholecystectomy,
Most
yeah.
relevant.
Relevant, yeah.
Okay, most relevant.
Most relevant, yeah.
Okay. Yeah. Wherever you feel, you can write, no problem. Okay. This is only a trial. Nobody will know what is your mistake. Only you will know.
Okay.
Then smoking history.
Relevant, yes.
Relevant.
Relevant.
Right. Wherever you want, right. I am not going to tell you whether it is right or wrong. I'll show you the things later so that you understand, what's your problem. General health.
Irrelevant, smoking history.
Semi-relevant. General health.
Semi-relevant. Because this 10 years he is not smoking, so it's a semi-relevant we can consider.
Okay. You are free to write in any column. That's your notebook, your pen, your desire, your will, your wish. Yes. General health.
Semi-relevant.
No, irrelevant. Irrelevant is crying. Current symptoms.
Relevant.
Most relevant.
Blood results.
Most relevant.
Relevant.
Weight loss.
Most relevant.
Children.
Irrelevant.
Irrelevant.
Depression.
Irrelevant.
Look time.
Irrelevant.
Semi-relevant.
Jaundice.
Most relevant.
Referral reason or reason for referring.
Most relevant.
Yeah, referral reason must be most relevant. Okay. Reason for referring.
Investigation
That is the
also.
purpose. Urgent investigation.
Yeah, most relevant.
Most relevant. Yeah, that also important. The purpose. Dog walking.
Irrelevant.
Tennis.
Irrelevant.
Childhood eczema.
Irrelevant.
Social drinking.
Semi-relevant.
Semi-relevant.
Useful background.
Semi-relevant.
Previous indigestion.
Semi-relevant.
Most relevant.
Most relevant.
Previous indigestion. Indigestion happened long back. After that, the person was eating biryani and all the things. Okay, whatever. Yeah. Now let's check. Okay.
Okay.
Most relevant. Current symptoms, blood results, weight loss, jaundice, referral reasons, urgent investigation. Semi-relevant. Previous indigestion. Omeprazole trial. Cholecystectomy. Smoking history. General health. Not relevant. Children, dog walking, tennis, childhood eczema, social drinking. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Out of 16, how many marks you got? You can just count. Was that okay? Somewhat okay?
Yeah, Father.
Yeah. Nurses, don't worry. Even if you miss something, no problem. Doctors must be accurate.
Mm.
And this will give you clear, visualization is the most powerful learning method. So this, even when you practice, try these things. Okay, highlight, then put in 3 columns. It doesn't take so much time. When you write, you feel whether it is required or not. Okay. Shall I go forward?
Yes.
Yes.
One more, depression and frustration. These are not relevant. Done?
Yes.
Yes, Father.
Yes, transforming case notes. Okay, the beautiful part of it, which you should really enjoy. Okay, I love it. Case notes. What you have to do? You have to transfer into simple sentence.
Simple
Heartburn,
sentences.
heartburn, indigestion. Can you make one sentence? Just write down one sentence. Let's see. Done? Those who are conversant to YouTube comment space, if you can type fast, you can type in here as well so that I can read, understand this. I'm writing to urgently refer. Mr. Knowles for assessment and tools. There is primary investigation for this pancreatic cancer. Mujasad, yes. Mujasad need quite polishing of your purpose paragraph. We'll do it. Smoking irrelevant because it is negative. Mr. Knowles has a history of heartburn and indigestion. He is having history of heartburn. Mr. Knowles reported feeling of heartburn. Done?
Yes.
Mm-hmm.
Presented.
See, this is one criteria, whether you know that technical professional language, especially doctors. It's like he presented. It's the initial presentation, right? He presented. It's not he is experiencing. You are telling someone else, right?
Yes.
It's not experiencing. It's past tense, over. In the first presentation, initial presentation, Mr. Knowles presented with heartburn and indigestion.
Mm.
Is it wrong if I wrote has a history of heartburn and digestion?
He has a history of, you can write, but not very perfect. But then it's okay, not for A grade, but for B grade, it's cool. I'll be differentiating those languages. I'll be differentiating also. Don't worry. Okay, but there are many options. It doesn't mean only this is the option. What Dr. Sola said is perfectly all right. Okay, but when it comes as a whole, they will see whether you are going with the same tone of language in every sentence, every paragraph.
Babasem ya docente versione sravia with epoxy.
Are you speaking to me? No. See, presented. This is in the initial. This is in the initial visit, right? So it's past tense. Mr. Knowles presented with heartburn and indigestion. Even in your mother tongue, you say that, no? He came. Maybe in the colloquial language, you'll say he came to the hospital with heartburn and indigestion. He came to the hospital, but we can't say here he came to the hospital. That's very colloquial. That's one criteria. Are you able to use the professional language?
Presented.
Yeah, grammar. Past simple tense is used. Why? The reason is because the symptoms were reported during the previous consultation, 2nd August 2019.
Yes.
Mm-hmm.
Presented. Simple past simple tense. It's over. No connection now. It's over. Already in the past. Done with. Okay? It has no connection to the present now. Maybe he presented with now he is quite all right, maybe. Maybe. I'm not saying. This sentence tells us maybe he's fine now. When he came with severe headache. He
Yes,
presented
sir.
with severe
Last
headache. Now after medication, he will be fine. He may not have any headache. Okay? So subject, Mr. Knowles, presented the past form of the verb with heartburn and indigestion as object. This is a simple sentence. Beautifully written. Why I am taking this pain of creating all these columns, spending hours together so that you follow it. Otherwise, you will practice for months and years and write and rewrite and attempt and reattempt. You won't succeed. This gives you clarity. Okay? Unless you are very competent. Okay? Then you can skip this and go. Right?
Okay.
And later I'll show you how, if you are not clear about these things, how your scores will be reduced. Okay? Then, case notes. What is the antithesis? Ineffective. Can you make a simple sentence? You have to smile when you write your sentences. Then only you will get correct sentences. He complained of heartburns and indigestion. He complained of not enough. He presented with heartburn, good, but then indigestion also was mentioned there. Over-the-counter antacids were ineffective. Very good. Salafa, yes. He complains of heartburn. Okay, we have moved from there to the next. Knowles complains of heartburn and indigestion. We cannot say he complained of. It must be, even to be correct, it should be complains. Complains, not complaint of. Not only that, it's not complaint of. He presented with the better aspiration. Now, if you go step by step, by the end of it, you will have clear expressions for every situation. It's not a big issue. Done. Simple sentence, over-the-counter antacids were ineffective. Many of you were right, yes. Now, grammar. Passive voice is used. This is the beauty, okay. You should have simple sentence, compound sentence, complex sentence, passive voice. Over-the-counter antacids were ineffective. Reason, because the focus is on the treatment rather than who used it. Rather than who used it. Focus is not on, for example, if you have to make a cup of tea, how will you say? Now, somebody try, if you can do it. Now you have to teach me how to make a cup of tea. I don't know how to make a cup of tea. Tell me how to do it. Anyone? You can type in also. Type in also.
Yeah.
In simple terms.
Yeah, put milk and add some water, sugar, and tea, and make it boil, and it will become a tea.
Okay, anyone else? I want a nice, tasty tea. You can type in also the steps.
In a pot,
3-4
add some water.
Okay.
Keep it in the gas for a while, and put some tea powder or tea bag. Let it boil for some times. Add milk. Let the milk and add some sugar along with it, according to your taste.
Okay.
For usually tea, we require more sugar. So once it comes to a boil, strain it and serve hot.
Okay. Anyone else? Over the counter. Okay. Tea with boiling water. Okay. You can type in as. Hello?
Yes.
Okay. You can. We need a little more better because passive voice is important. Can you see the screen?
Yes,
Father.
we can.
At YouTube? At YouTube?
Yes, Father.
Is this okay?
Yes, Father.
Listen to the steps in a simple process. This is how you make a cup of coffee. It's an. Is this okay?
Yes, Father.
Any problem here?
You fill the kettle with water. You turn on the kettle. You turn on the kettle. It's a wrong.
You turn on the kettle is okay. Yes. Turn on the kettle is the expression is okay. You say turn on the kettle means, you know, tea kettles, teapots, electric ones. Yeah, you just turn on. Not the gas
Boil
stove.
the
Also.
water.
Boil the water. Boil the
The
kettle is
problem, I
also
think,
okay. Boil the
the
kettle
coffee
is
or
okay.
I think the coffee or the tea are not there.
Add some sugar, then you can drink it.
There is no coffee. You didn't add
No.
just water
Okay.
and.
Okay.
Father, if black coffee is preparing, then we can take the coffee powder and add the hot water in there and mix
Okay.
it.
Now all these sentences are wrong. Why?
Yes, yeah,
Because
they're right.
now whether you fill it or someone else fills the kettle with water, that will be tea, right?
Mhm.
Whether you fill it or your daughter fills it, or you turn on the kettle or your daughter or son turns on the kettle, it's okay, right? May not be you. Or you boil the kettle. Anyone can boil the kettle. I can boil the kettle. It will become tea. It will boil. You pour the hot water into a mug. No, I can pour the hot water into the mug. That will become a coffee or tea. It may not be you. Anyone in the world. You add some sugar? No. Some sugar is added. Focus is on the action, not on the subject. That is called passive voice. Focus is on the. Okay. If you are not sure, you can just write down these sentences. I'll show you the right sentences next. So that write down with one line space. This is very important. If you are able to use one or two passive voice in your letter, that will boost your score. Yeah. This was not in our PPT, just I took it because from your response, I heard you are not confident about what is passive voice. Passive voice simply means subject is not important, action is important. Focus on the action, not on the subject. Your language also should focus on the action. This is something which I teach for IELTS students, so I took it from there just now when I remember there is something. Passive voice is very important for IELTS writing. Sorry? Done?
Yeah, I'm thinking. Yeah. I'm trying to think it in my mind. Yeah.
Yeah. You fill the kettle with water. What is the verb? Fill. The subject, you. The object, the kettle. The passive verb is fill, is filled. The sentence is, right sentence is, the kettle is filled with water. Not you fill the kettle with water.
Yes.
The kettle is filled with the water is passive voice. Who fills is not material, right?
Anyone.
Maybe you are 10 of you are there in your house. Anybody can fill. May not be you. She can fill, he can fill, they can fill, anybody can fill. You turn on the kettle, the verb is turn on, the subject is you, the object is the kettle. The kettle is turned on, not you turn on the kettle. So you boil the water? No, the water is boiled. The water is boiled. You pour the hot water into a mug? No, the hot water is poured into a mug. Your subject is not. You add some sugar? No, some sugar is added. Then you can drink it. Then it can be drunk. You can drink it, or your friends can drink it, or the cat can drink it. So then it can be drunk, but we do usually say then it's ready to be drunk. Even if you say then it can be drunk, it's correct. But usually say then it's ready to be drunk. Okay, that's not our business. Just I thought we should have a clarity because it's going to be important for us. Got the idea, right?
Yes.
The message is that subject is not important, action is important. Let's go back. Yes. Over-the-counter address is very ineffective. Passive-voice reason because the focus is on the treatment rather than who used it. Okay? Focus is on over-the-counter antacids. Whether who used this is not important. It's ineffective. Where is the past form of the verb be followed by the past participle? Ineffective. Where ineffective. Antacids, plural. Okay, next one. Omeprazole, PPI 20 mg twice daily. Sorry?
This is Jyoti. Can we
Yeah,
write the over-the-counter antacids which was prescribed were ineffective?
Conciseness is the problem. If you can write in lesser words, you should do that. Like Dr. Saraf was telling earlier, put it in one single term maybe. So that is right. But the problem is regarding concise and clarity. Conciseness and clarity, your score will go down. But what your sentence is right, perfectly right. Okay? But then you can use passive voice. Yeah. Can you write one simple sentence? Please, which one is correct? Is it complaint or complained? Mr. Everest, you are asking me, please, which one is correct? Is it complaint or complained? In this case, it's neither complaint nor complained. Okay? Usually in OET, you don't write complaint and complained. You will write the situation. It's not his complaint that is to be stressed, but what is the complaint is the stress. That's why you use words like he presented, or otherwise, if at all you have to use not complaint. Complaint is what was the complaint? Complaint was headache. Complained. Second one, what you have written, second one is the right one. Complained. COMPLAINED. But here it is not applicable. Over-the-counters drugs is ineffective. Over-the-counters antacids, you can't just write drugs, okay? What is given there has to be mentioned. Drugs means it's a general thing. You can't write that. 20 mg twice daily was prescribed for 8 weeks. Now you are a doctor, Sulafa. Why you prescribed by whom? By you or someone else?
This by me,
Who prescribed? Who prescribed? Yeah, you are the doctor who are writing. If you are a nurse, you can write. It was prescribed by a doctor, not by me.
But they said it's not preferable to write in active form.
Okay.
Yeah.
So,
I prescribe.
I prescribe. Doctors always must write I prescribe. This is the only difference in this letter, maybe. Okay. Nurses will write what Salafa said now. This was prescribed. X and Y was prescribed by the doctor. You are telling another person, another health professional, this was prescribed, not by me. But any doctor writing the letter must say, because they said you are the doctor.
Yeah.
That's why I said,
But
who are you? You're...
I've heard that in OET writing, the active verb is not preferred. It's better to write in a passive, even if you are the one who did the action.
No. In doctor's letters, you have to write I prescribed. You can't write it was prescribed. If you use there, it was prescribed by somebody else. It doesn't mean you prescribed at all. For example, paracetamol was prescribed by me, you can't say. So only for doctors, this language option is appreciated by OET.
Okay.
Okay, I prescribed omeprazole 20 mg twice daily for 8 weeks.
Okay.
Yeah, if you have a different sentence, write this sentence and compare. Okay, there are different ways of saying, but this message should go.
Okay.
Okay, grammar is past simple. I prescribed is the past form of the verb, object omeprazole, dosage 20 mg. See, whenever you have such case notes, take this syntax, this word order. Okay.
Okay.
See, first you have to write the subject, then past tense of the verb, then object, what did you prescribe, the name of the drug, then the dosage, 20 mg, twice daily for 8 weeks. This language expression definitely you will have in all the case notes. This is the best syntax. Syntax means word order, S-Y-N-T-A-X. Syntax means word order in a sentence. That doesn't mean you have to learn this by heart, okay? But this syntax, unless you have an idea about the syntax, you will not be able to develop your writing skills.
Okay.
Am I making some sense?
Yes, sure, Father.
Yeah. If you want me to go slow or fast, you can tell me, okay? Doctors often use the first person when describing their management.
Father, as a nurse, we can write omeprazole 20
Was
milligram
prescribed.
twice daily.
Weeks was prescribed.
8
Yeah.
weeks
Was prescribed. Yeah.
He was prescribed.
Was prescribed. And you have also option to write the dosage in the brackets if you want. Yes.
It's okay to use brackets, sir?
Yeah. Here in the dosage you can use. Only for dosage. Not for other things. But usually it's better not to use brackets, but even if you use brackets, that's allowed. But don't use all the things in brackets, okay? Whatever you get confused. Connectors, if you are not able to use connectors, that will be penalized. No improvement in reflex symptoms. Fast, one simple sentence. We'll be jumping into next segment. Comments team on a course of omeprazole. Yeah, that is also okay. So if a comments team on a course of omeprazole is also okay. That is cool. That's another option. Comments to him on a course of, yeah, that's great. Completed a course of omeprazole 2024. Completed was not mentioned there. It was prescribed. Don't write something which is not mentioned. Yes, slow down. Somebody is saying slow down. I am slow. I'll go slow. Yes. And if in beginners, if you find a challenge, let me know. Okay, we'll take a separate session for you. But only thing you have to sometimes my WhatsApp is in trouble. YouTube comment space is the best way. I look into every comment. So I get an idea. You can just comment there. What is the challenge you have? Consumed tablet omeprazole 20 mg twice daily for 8 weeks. No, you can't say consumed. It must be prescribed. Okay, not consumed. They did not say whether it was consumed or thrown away. Nothing is mentioned there in the case note. Okay. He has no improvement in his reflex symptoms. Okay, let's go. His reflex symptoms have not improved. Grammar, present perfect tense is used. You see, these are very few tenses, okay? I'll tell you where you have to use exactly later. The reason is because the lack of improvement continues up to the time of referral, even today, even now. The past tense is used when the thing is over, okay, in the past. Now, it started in the past, it continues to the present, even today. His reflex symptoms have not improved even today. That's why we are using
Present
perfect. Started in the past, extends to the present. Okay? But here people make a problem. Very most common mistake is this: his reflex symptoms has not improved. Many letters we find has not improved. Symptoms plural.
Have, yeah, it should be
have. Yeah. And the people say he have headache. He has. Singular is has. His reflex symptoms, subject.
Not.
Present, this is not past verb, okay? Present perfect. Verb, that was my, when I just copied it. Present, here it's not past verb, present perfect, okay? And the past participle, not improved, not improved.
Father, instead, can I write his symptoms have progressed or deteriorated? Have deteriorated?
No improvement in reflex symptoms means neither deteriorated nor progressed. No improvements means neither progress nor deteriorated. No improvement at all. No improvement means no improvement. It's stagnant. So it remains the same. Neither improved nor deteriorated. So it's a stagnant position. Yeah. If you write the other one, it goes. The meaning is different. Yeah.
Okay.
Right is not being improved.
Maybe if a staff nurse, registered nurse writes this, doctor will be very angry. She's saying after my treatment it deteriorated. Right? Okay. Yes.
Can we write persist? His reflex. Can we write his reflex symptoms have persist?
His reflections. Can you just type in the comment space?
Yeah, persisted.
Persisted. No.
Yeah. Okay.
His reflexes have resisted now.
Can we write is not being improved?
Refractory.
One at a time. There was.
Can I say refractory reflex symptoms?
Saturated, no. That is clearly saying there was no improvements. It is same as it is.
Is not
Saturated
being
also.
improved.
Saturated also has a thing like it got worsened, like saturated. It neither improved nor deteriorated nor saturated. Better to use same expression to give the correct meaning.
Okay.
But more than deteriorated and improvement, saturated is close by meaning. But then if you can write the exact meaning, that will be better. Saturated may be tolerated. But saturated is not a medical term, right?
Further, can I refer the lack of response to Mr. Knowles and not the symptoms? I mean, he himself had not responded or has not responded to the medications?
No, you can't interpret it that way. He might have responded. That's not given here. That's why I said, as per the case note, don't interpret the case note. You can interpret the case note connected with the side headings given. Side headings given. No other interpretation. Now you are saying he did not respond. He did not cooperate. It's not mentioned there. He may be cooperated very well, but then his reflexive symptoms did not improve. Do you get me?
Yes.
Yeah, don't blame your
Very well.
patients unnecessarily. Yeah. Yeah. Good.
Okay.
Okay. Good.
Good
Yeah.
point. Thank
Can
you.
we write
Good
is
one.
not being improved?
Pardon?
Instead of have, it's not being improved.
Not being improved. No, not being improved is not okay. There is no improvement. Being is the continuous, progressive. They have said no improvement. It's a categorical statement. It's not ongoing. Sorry. Oh, this one was not written right. Next case note. Did you go back to the other one? Sorry, we have completed it, right?
No,
Concern is not completed.
Sorry. Yeah, let's write this. We'll finish it. Then I'll give you some homework. Probably, I think, is it enough now for now? Simple sentences? First, I'll give you homework.
Yes.
See, main concern is back pain. His main concern is back pain. Very simple. Present simple tense describes the patient's current condition at the time of referral. His main concern subject, verb, is past participle, back pain. Diarrhea, pale stools, all homework, okay? Abdominal pain on eating, all homework. Fatigue, homework. Lost 2 kg of weight, homework. Abdomen tender, homework. Abdomen slightly swollen. I'm just passing through it so that when you watch the video, if at all you don't get something, you can write down, okay? That's why I'm just clicking and passing. Okay? Abdomen slightly swollen. Hello, discoloration of skin and eyes. Now, to save the time, okay? All this has to be transformed into simple sentences. All these are relevant case notes, okay? No need to write down these things. You can even revisit the video and write down if need be. All these case notes need to be transformed into simple sentences. Okay. What are the grammar used? Why they are used? Past simple. Where do you use it? All the previous consultations. You see dates, previous dates. Whatever the case notes you select from there, past, simple past will be used. Previous treatments, all the previous treatments, you must use simple past tense. Previous prescriptions, he was prescribed. Previous discussions. Now, write down when you see a case note, see that is the previous date. So consultation is given. Previous treatments are mentioned. Previous prescriptions are mentioned. Previous discussions are mentioned. Not the current one. In this visit, the previous visits. So you have to use simple past. Are you exhausted?
No further.
No,
We'll
it's
take
fine.
2 minutes. You can take 2 minutes break. Otherwise, next things are important. Unless you get it properly, you can wash your face and take up snacks. 2 minutes or 3 minutes break.
Okay. Thank you.
Yeah. I'll wait. Don't worry. Until all of you come and say we are here, I will wait. Because this requires some more. If you are exhausted, I can stop and have next day, okay? What do you say, Dr. Saleen?
No, it's okay, Father. I'm not...
No. Is it going okay? You are understanding, getting the things?
Yes.
Yes, so great.
These steps you have to follow. Okay, but that's why I have spent a lot of time preparing these PPTs.
Thank you, Father. Really.
That's
Thank
nice,
you.
because otherwise, by just saying, you may not get it. That's why I'm showing you.
Yeah. God
Take
bless
every
you.
case note. Yeah, yeah. Got it. Thank you.
Thank you.
That's nice. Now we can take you step by step without any difficulty, all the 4 modules, provided you have the patience to stick on to the guidelines. Our major problem is, yes, please.
I have a question.
Please.
These new symptoms that the patient presented in a compound sentence.
Compounds, don't jump over. We are coming to compound sentence next after this. Then we are coming to complex sentence. We will not take so many. That will be homework for you. We will take 3 or 4 each. Okay. Now, next step after this, I'll be telling you the same case notes. We will take 3 or 4. How to frame compound sentences from using 2 simple sentences. And upcoming next step will tell you how to use the 2 simple sentences to frame 1 complex sentence. Clearly, I will tell you what is to be used and the sentence structure, syntax, including comma, conjunction, and all those things. And the relative pronouns, how to be used. That will be explained. But before that, you have to eat something or drink something, get energy, wash yourself.
Thank you.
Yeah. That is mandatory. Okay, don't strain yourself. Always I am concerned, you should not strain yourself when you study OET. Only if you're able to enjoy, otherwise stop. You can watch the video later. You might have seen recently I put a small video about 4 approaches for OET. See, real classroom can be effective 90%, face-to-face real classroom. This one, what you call virtual classrooms, that is Google Meet or Zoom classrooms, that can be effective maybe somewhat around 70% or 60 to 70%. And watching just recorded videos in the YouTube channel, same classes, maximum it will benefit 40%, not more than that, unless you are very competent user of English. People feel that, okay, watching will be cool. That is not cool. Otherwise, I could just record and send it. I need not wait for your timings. You need not wait for my timings. I can simply record it, upload it, right? Or I can just go live and record anytime as per my convenience. But that's not going to be as powerful as attending real directly, even in the virtual classroom. Because I have seen during holidays, all 2 months, we used to have 15 days live sessions. And all those who attend the live sessions passed very easily. Because within 15 days, we could give them crux of it. We should sit together and work out materials. No?
Yes,
Father,
because
is it
during
possible
live
now?
session, you can ask.
Sorry? One at a time.
Is it possible in the presence?
Yeah,
Because we find difficult. Day to day, we are working and we are doing studying. It's not concentrating because it's 15 days or 1 month. If we are doing that concentration, everything is there. So that is effective, I find.
Yeah. That's what I said. Real, because you are not into virtual classrooms. Your age people like you have been into classrooms. Maybe next generation kids will be like virtual. They'll be okay for them. But this generation, maybe your generation is like writing and sitting in front of the teacher and learning from KG till your nursing and or medication, MBBS. You have done same way, right?
Yeah, Father.
Yeah, unless you have done some distance courses. So that's more powerful. Otherwise, you should have enough time, like sit like this, casually take breaks, enjoy, go and sleep again, come back and discuss. Those things will also help more than just attending one session and going and watching anything and everything from everywhere and getting confused. Information overload is the main challenge of OET aspirants. Otherwise, any doctor can easily crack it, provided they go step by step. With the instructions, 4 months, 4 modules, 30 minutes a day and 1 hour session in a week. More than enough. Yeah, 1 hour session requires 5 days, 30 minutes practice. That will be perfect. Then I can guarantee A grade without any difficulty. Otherwise, I can pay your fees, exam fee. We have done it when we were doing a real classroom. When I was in the campus, we had OET classes, IELTS classes, real classroom classes. The challenge was that we used to charge them 10,000 rupees for the whole program. We will first do an assessment. I will be doing an assessment of their skills. Then we will prescribe maybe 2 months, 3 months, 4 months, what is required for you. After 4 months, we will ask them to book that exam date. If they don't get the required score as mentioned earlier when they came to me, the whole 10,000 will be refunded. Will not take even one single rupee. I still remember one girl, she met with an accident on the way to the examination hall. We were expecting definitely A grade from her. She was very brilliant and practiced very well. Accident in the sense, just the buses, just rubbed each other. There was not a big accident, but she got so tense. By the meantime, I sent somebody with the bike and he picked her and sent to the next bus stop, and she reached in time, well in advance. But then she was so much tense, thinking that I'll not be able to reach, all those things. Something happened to her. So she lost it. One paper, she lost it, one sub-test. And immediately, she would not consent, but immediately I refunded into her account 10,000. I said reasons are immaterial. If you don't get the score after coming and joining us here, the money has to be refunded. And by the meantime, anybody who has taken membership or anything, if you want any personal assistance, let me know, okay? We are doing it because tech team has clearly told me we can't manage the whole show because they are managing the show, right? Managing the platform and expenses, other things, so many things. So they have kept these prescriptions or what you call super chat. Nothing was there earlier. Maybe you can ask the admins, they never knew about it. We never had it. Then my tech team said, whoever is willing, let them do something. That also helps reach and helps the benefit of the platform. Yes. Otherwise, we don't want to make any money out of this platform. Yeah, if I want to make money, we can take personal sessions and make any amount of money. Yes. And actually, personal sessions are endorsed only for collecting money. There is no benefit. Actually, group sessions are better for learning. Discussions, sessions, than sitting alone and getting bored. Yes. You don't have anything to drink? So, Dr. Salafa, Varsha, Mini?
We have water.
Water.
No, you need something for your brain.
I drank tea for session start.
Late night, don't drink anything.
Late night OET. Actually, I don't recommend such long sessions, but I don't know because timings are a bit problematic. That's the problem.
Yeah.
Whenever I see some people help each other, I really want to help them. That's my nature of doing things. Yeah. I love that. People helping each other. Yeah. Dr. Salafa is doing a great job in that way. I don't know how she manages the time with her duty and all that.
Try in between, yeah.
Yeah.
Between my duties.
Yes. That is something. Give me 1 minute. Okay. Have some discussion. Yeah. 2 minutes, just 2 minutes. I'll go to the washroom.
Okay.
You can discuss something, yeah. So that if somebody new enters, someone new enters, they will be like. Are you ready?
Yes.
Just type in yes if you are ready, if you have reached in the comment space.
Excuse me, sir.
Sorry,
Sir, can I leave?
I didn't get you. Sorry.
Can I leave it, sir?
Yeah, please.
Oh, thank you, sir.
Yeah. All those Indians, if it is too late for you, you can sleep, okay? There are people who are in the morning and in the evenings, 4 o'clock, 5 o'clock, 6 o'clock. It's cool for them. For Indians, except me, it is too late. 12 o'clock. 12 o'clock now.
Can I stop, Father? We can continue
Midnight.
tomorrow if you have a.
No, I have no issue. It's all up to you. Participants, let me know. Just type in the comment space. What do you want? Continue or continue tomorrow? Because my mind should be able to absorb. Otherwise, there is no meaning. You'll get
Yes.
exhausted. Otherwise, tomorrow we have at 8:30. We can continue, no issues.
Yeah.
What do you say? Just type in. Those who are at YouTube. I really appreciate Chandravadini. Yeah. Right. Thank you for your membership. Yes.
Tomorrow, Father, Sunday.
Sunday, 8:30 Indian time, evening, because there is no discussion.
Yes,
This is specifically because these people are Dr. Salafa and team. They are from country where this time 8:30 is convenient for them, evening time. Usually Sunday I don't take up. This is an exceptional situation where they feel it comfortable. So after six usually our platform is on. Till 6 it is off. Yeah. And when you come with some snacks and something where you can refresh yourself, relax, and if you start discussing, you'll get more energy than being passive. No?
Yes, Father.
Can continue. One answer, two answer can continue. What do you think? Continue tomorrow. Yes. Acha ready. Sash Anthony is ready. Please continue. Please let's continue tomorrow. Exhausted. Yeah. Further, I have no problem. I can attend now. Okay. Yeah, majority are saying tomorrow. 3 have mentioned continue.
Okay, Father. If
Now,
they want
yeah,
to
now
do
give me suggestions tomorrow. Do you require more of the transforming case notes, or should we proceed with other steps? Like compound sentence we will do, but then simple sentences, are you able to do it? Do you require more assistance?
Father, with the tenses, how we can convert the sentences? Is that format?
Fine, yeah. Conversion is fine. We can go further, I believe.
Okay. Now, next step, we will take very few of them, 3, 4, or 5. We will show you how to. It's simple. Compound sentence is simple, taking 2 sentences and connecting with a conjunction.
Conjunction.
And a comma, if need be. Oxford comma.
Yes.
Okay. Yeah. And complex sentence, you require a bit of because you begin with usually you begin with a complex sentence. The purpose sentence is a complex sentence normally.
Yes.
So if you have a command over complex sentence, if you use 2 or 3 at least 2 in your whole writing, that will give a good impression. And not very difficult. Like you'll have to connect with
comma and conjunctions.
Comma conjunctions. Means yeah.
Okay.
That is like the dependent clause first or independent clause first. That 2 ways you can. Once you write dependent clause first, next sentence you can write independent clause first and prove that you have a command over. It's not difficult once you have the clarity. We'll show you exactly everything, structure of, as I have shown to you today, no? Dependent clause, comma, plus conjunction, plus independent clause. Independent clause, no comma, plus conjunction, then dependent clause, all those things here.
And Father, which paragraph contain which sentence, means tense, like which sentence supposed to use in which paragraph?
Now, those of you who really want to, now it will be, Dr. Salofa will have it tomorrow, right?
Okay.
But anyone who wants to clarifications or beginners, if you want anything, you can be here. You can discuss with me for some time, okay? So that you don't get confused. Others can definitely, you can exit, okay? And yeah, if you don't mind, you can keep your YouTube on until you go to sleep, so that it will reach some more people. That will be wherever you do to the platform. Even if you're exiting, you can keep muted and keep your YouTube connected until you sleep. If you have data, free data, otherwise don't do it.
Sure,
Okay.
Father.
Yeah, that will help the reach. Yeah.
Okay. And just before I leave, if you can explain for us tomorrow the types, it will be better. The types of the question about the types of letter writing, the thematic, the ISPER, and so forth. If you could add it to our tomorrow task.
Three types of letters. Three types of letters.
Because we have confusion regarding this.
Yeah, sure.
Yeah.
3 types of letters. Now we are dealing with the referral letters, but then we will have to take up one more. Tomorrow session we will complete this. Then maybe you can give me a case note of a different type.
Okay.
So that I can, otherwise you won't get it. Just telling without a case note working out, you may not get it. What's the difference, no? As I now we have done both referral letters, right?
Yes.
Yeah. So since you gave me the same, I thought you need more on referral letters.
Because this is urgent referral, the second one. The first was classical, the occupational therapy. But this one, it is urgent referral,
Yeah, urgent reference, emergency, That's why we have the current situation in the first paragraph. You understand that, right? No? Current situation in the first paragraph, because it is urgent letter. Immediately you should tell them what is the situation now. That's why we have immediately upper purpose, you have the current situation. There is all the emergency urgent situation letters, you need current situation soon after the purpose paragraph. Yeah, those things we'll be explaining. I'm not going very fast and confusing. Now, next, you can send me one letter, another type, transfer letter or something. Then we will explain and compare each other and clarify everything clearly. There is no major difference, only very minor differences. Okay? When you write purpose, there is a difference in the articulation of verbs. Words,
the purpose is same, but the paragraphing. Because we were discussing, me and my colleague Wafa, about the letter of today, the Adam Knowles, urgent malignancy in UK, usually it is not regarded as emergency. It is a type of referral within 2 weeks, unlike the emergency department.
No, it's like don't use your knowledge at all. That's also they are testing you. See, a professional should be able to just read and understand, do what is asked for in the letter. You may have better options.
Yes.
But then you are not supposed to. No, as per the letter. If it is says emergency, even the headache is emergency in OET letter. Okay? Even sneezing is emergency.
If sometimes it is stated clearly for in the writing task, refer for the emergency department. For example.
Emergency department. Emergency means it must be emergency. Okay? This is urgent consideration doesn't mean emergency in that sense. Okay. As you said, here it is not urgent, but urgent consideration when you say, it must be current situation must come soon after purpose paragraph. Because you have said it is urgent. Immediate assessment is required. That doesn't mean it's not equivalent to emergency department. Okay, that's entirely different. Understand that difference. Urgent consideration is not emergency.
Exactly.
Maybe they are of the same nature, but not the degree is different. One is urgent, immediate assessment is required, maybe after a day or 2 or 3. Emergency immediately.
Yes.
At the earliest. With top priority.
Okay. That's clear.
Yeah, there is a difference. Yeah.
Thank you, Father. Thank you
Yeah,
so
yeah,
much.
you're most welcome. Yeah, most welcome. Anyone else? Yeah, beginners or anybody wants to discuss anything? Yeah, you are most welcome. Yes, Dr. Salapa, you wanted to say anything else?
No, I just will take my excuse. I will continue through YouTube. Thank you so much.
Yeah, sure. Thank you. You are most welcome. Yeah, yeah. Those who leave, you can keep connected to the YouTube. Yeah, thank you. That will be great. Any other discussions? Anything you want to know? Even in your vernacular, you can discuss now. You want to ask me something in your own language, if I understand. I can understand basically like Malayalam, Kannada, Tulu, Konkani, and maybe a bit of Hindi. Those things I can assimilate.
Father, Punjabi.
Punjabi, you'll have to teach me, ma. Punjab is a beautiful place. I always cherished my visit to our rock garden, Chandigarh.
Chandigarh.
Yes, I have come there to Patiala, Chandigarh, and all for teachers training programs.
Okay.
Yeah. I had students from Punjab, many students. Yeah. Yes, Punjab is nice. Punjab people are they are the best hosts in India, it seems.
Yes.
Yes, I like one day I visited one house after a program in the evening, and they were serving me. I was eating. Again, they are serving me, compelling me. Then I didn't know what to do now because I could not eat more. Then I left because I don't want to waste them. But then while returning, somebody said, unless you leave a bit in your plate, that shows that you are not satisfied. Guest is not satisfied. So they will keep on serving. So leave little bit. So I didn't know that.
Yes, Father.
Is it true in your place?
Yes, Father. I'm
Okay.
from Jalandhar.
Jalandhar, okay.
Okay.
Yeah. Anything else? Anybody at the YouTube comment space, you can type in. Could anybody reply, how can I join, please? Where do you want to join, Master Bala? You can just, somebody type in my phone number there. I can't type in easily because I have cellulitis on my right hand. Please, 944-844-1393 WhatsApp. 944-844-1393. Somebody please type in the YouTube comment space. Somebody is repeatedly asking, how can I join? Details below the video. Yes. Yeah. Below every video, there is details. My phone number is there. You can WhatsApp me your full name and what assistance you require, where you want to join. If you want to join Zoom, normally you can send a request at WhatsApp. We will send you the Zoom link personally. Zoom classroom. Yeah. Somebody typed it in the YouTube comment space. 944-844-1393.
93.
Yeah, 944-844-1393. Father Dr. Saleen Joseph. Somebody is asking how to join. It's not clear where to join. Maybe to the Zoom classroom. And as you know, this is an absolutely free platform. Now, WhatsApp is asking for money. If you are very sure you want paid messages, you can pay for the messages and receive messages every day. It's charging me 1,000 messages, 850, means 85 paise per message. So if you are particular, you need personal messages, personal links to be sent, I can broadcast it. Creating a separate group that you can mention me in the WhatsApp message. I would like to. Okay. If you pay 100 rupees, you will get 100 messages, 125 messages. Yes. That's for WhatsApp, not me. Yes. All services are free. Yes. Chandravadini, thank you so much. You are really, your support is really fabulous. And try to just send some messages in the YouTube comment space whenever a video is fast. Support your friends when they make some shorts and all that. At least a heart, just one press, one click, one like, one congratulation, one emoji will help them boost their courage, their confidence. At the same time, it will help our reach as well. Any clarifications you can make now? This is the best chance for you. Okay. I love OET and Edu Skills. Thank you, Sash. Thank you. And on writing, if you have any doubt, I can also access now some basic videos or any doubts I can answer. Yes. Come on. Yes. Anybody finding any comments in the YouTube comment space which I skipped? You can tell me. Just thank you. Yeah. Yes. Once again, thank you. Yes, Sash, and thank you for your wonderful explanation. Yes.
Father, hello, Father.
Please, yeah. Yes.
Yeah, I have a quick question because I'm confusing about the purpose of this letter. Because the problem of this purpose or introduction, I mean the context, it is similar to the goal.
Goal, yeah. Purpose is goal.
No, I
What is
mean
your goal?
um,
What is the goal? For example, the assessment of what we call assessment is the purpose. What is the goal?
the goal for assessment for the pancreatic malignancy.
Yeah, assessment is the purpose. For what purpose? What goal? To pancreas to identify
Suspicion of pancreatic malignancy.
suspicion of
Yeah.
of pancreatic malignancy. That is the goal.
Malignancy. Yeah.
This is the goal.
Yeah, I feel in this letter the goal it is similar to the problem. If I wrote in the introduction, the Mr. Noel has features suggestive of the pancreatic malignancy, then I will write the same. I think there is some repetition.
Sorry, I didn't get what you mean. Repetition? No. You need not write he has this one. It is not he has. It is suspected. You have to use the word suspected because question mark is put there in the case note.
Yes.
There is a question mark, so you have to interpret that question mark. Question mark means suspected.
My question in the other way, what is the problem of this patient?
His patient is problem is this one, suspected pancreatic malignancy.
Okay, thank you.
That's the problem. Yeah.
Thank you.
We'll get into it. All those auto, bus, and cycles we will ride tomorrow.
Inshallah.
Yeah. And try to do that, those 4 questions, if you have attended the previous session.
Yes.
Try to see those 4 questions, yeah?
Yes, 4 questions.
And, yeah.
With the patient and what is the problem is, and what is the assistant required, and why is the assistant it is required, yes.
Yeah. Yeah. Please explain that you are right. Was used only in the past. Was used only in the past, yes. Thank you for that. And please explain difference of was and has. He has. Has is present. The synonym of was of has is had. He had. He was sleeping. He had dinner. Okay. Somebody is asking the difference between was and has. Was is past tense, has is present tense. He has epilepsy. He had epilepsy. He was sleeping when I reached there. He was sleeping. Okay. Yeah. That's for a situation. And had, have, this is when you say an experience or a situation. Is it with it is with pleasure that I find time to watch this live. God bless you. Yeah, you are most welcome. And I can, I think there is one purpose video. Let me check if I can show you. That will give you clarity on that. One sec. Writing.
Father, when is has had been used? We can use has had.
It has had. One sec, I'm coming back and just searching for something. One sec. Come back. Writing links. One sec. Have you seen this grammar step-by-step video? I'll just click on it. One sec. Give me one sec. One sec. Where am I? Hello? Am I connected? Hello? Yes. Can you hear me?
Yes, Father, you are audible. Yes, Father.
Okay, one sec. This tense. I'll show you tense. Yeah. Here is the tense. Let me know if you can hear, okay?
It's going to be, I'm going to make it very easy, simple. The tenses or the grammar required, that was the greatest concern, repeated concern.
Is it audible and visible?
Yes, Father. Yes, Father.
Yeah, you see, I'm briefly explaining here this video clearly about tense, what is to be used for all the tenses for OET.
Time and again in the Mentors Hour. So looking into the basic grammar required, along with that, some other aspects as well. So use of tense, using present tense, you know, I do, he does, he makes, he comes, you know, third person singular, we'll be dealing with it. Do, make, come, that is present simple. Past simple is did, made, came, he did, he made, he came. Using the present perfect, he has done, he has made, he has come, we have done, we have made, we have come, all those things. And using the present continuous or work, or I usually use as present progressive. He is doing, she is making, and she is coming, all those things. So we'll be going into detail of these things. Okay. So use present simple tense, and using the present simple is do, make, come, examples. So use of present simple tense, why? To report unchanging facts in your case note. Why do you need to use the present simple tense or present a simple present tense, whatever you want to say? To report unchanging facts. Information is true in the present and is not subject to change anytime soon. It's not going to change in the near future or immediately. So the purpose of using simple present is to report the unchanging facts that is given in your case note. And where do you use present simple sentence? At the beginning of the letter. Okay, when you report the patient's name, age, and status. This particular part, at the beginning of the letter, you have to use the present simple tense. And next, for example, the patient is 29 years old. She is divorced and has 2 dependent children. This is simple present tense. The patient is allergic to penicillin. This is also simple present tense. So also this is used to provide the patient's unchanging status and profile. Whatever is unchanging in the present condition of the patient, you use simple present tense to provide patient's unchanging status and profile. You use simple present. And use of simple present tense when something happens on a regular basis, frequently, or happens now. And happens now. Something happens frequently or on a regular basis, and it is happening now. So for example, Mr. James, the construction sentence should be, Mr. James experiences chest tightness. It is not Mr. James experience chest tightness. That is a common mistake you make, and it's one of the major, we can call mother mistakes in OET. Subject-verb agreement. When the subject, Mr. James, is third person singular, in the present tense, the word should carry with it S or ES. Okay, that will be explaining. Mr. James experiences chest tightness, which means Mr. James experiences chest tightness on a regular basis. Happens frequently, and now he is still experiencing chest tightness. So that's why we use simple present tense. And use of, for instance, simple sentence versus case notes. For details such as lifestyle choices, the present tense is appropriate. Where do you use in the case note? The present simple tense. Lifestyle choices. When you speak about lifestyle choices, you have to use the present simple tense. For example, despite previous advice, Mr. James is still smoking 20 cigarettes a day. So, despite previous advice, Mr. James is still smoking 20 cigarettes a day. Still, even now, he was smoking, he is smoking. So, we are giving him the details, his lifestyle detail, his habits. Okay? There you have to use present tense. Again, to describe the patient's current social background, B, I have put capital because I am also assuming that you have in place. The background B is given capital because I want to highlight that we presume is bar. So to describe the patient's current social background, you have to use simple present tense. Now, if you know is bar, you can clearly make down between background. You have to use simple present tense. What tense has to be used? So tense is the crux of communication, I tell you. Tense decides in the impact, the meaning, and what the reader understands about your patient. For example, Mr. James smokes 20 cigarettes and drinks 2 bottles of wine daily. This is a background given, social background. So this is simple present tense. You have to construct sentences from case notes in simple present tense. There is no confusion. It's exactly clear, crystal clear. Use the simple present tense. Okay, Miss Jessica is overweight and has a BMI of 27.8. Mr. John lives in Lake Park with his 70-year-old wife, Mary. So these all are simple present tense. So when you speak about in his background, social background, you have to use simple present tense. That's why I said you don't require a personal trainer, or once you complete this course, maybe 2 more sessions on writing, you don't require anybody to correct your letter at all. You can make out, because I'm teaching you every sentence structure and where it has to be played, which tends to be used in particular aspect in ISBA, in particular constructing sentences for particular case notes. Everything will be crystal clear. So write down the things, practice it, and you should be a teacher for yourself. You should be able to assess your own letter. That's the best part of it. That's called experiential learning. Again, I'm going extensively on use of present simple tense. It's also used to describe anything that occurred during hospitalization that is still continuing. Simple present tense is used to describe anything that occurred during hospitalization that is still continuing. When you're writing the letter, still it is continuing. The condition is continuing. Mr. James needs assistance with dressing, toileting, and transferring. See, I have put still within brackets. Mr. James still needs assistance with dressing, toileting, and transferring. So still is optional. Whether you need to write there, you don't write there, it doesn't make any difference in the meaning. So even by writing, you will be penalized. Even if you don't write, still you will not be losing anything. So it's up to you. If you want to fill in the words, definitely you can use. But if you need to write more, you can avoid. Mr. James needs assistance with dressing, toileting, and transferring. Okay, so something that is happened during hospitalization, still it is continuing. So the reader will understand what is assistance to be given to the patient or client you are referring to. Okay, yes. Miss Jessica consumes a low-calorie diet in order to maintain her weight. So she is consuming low-calorie weight She was consuming, she is consuming, she will be consuming. She has to be provided with that. Hope that is clear to you. Yes. Present simple. See, repeated action. Yesterday it happened, now it's happening, tomorrow it will happen. Okay? I eat lunch every day. So present simple timeline is this. This is present, this is past, this is future. It was there, it is there, it will be there. Repeated action or habits, we say. Okay? Mr. James experiences chastisement. That he was experiencing, he is experiencing, he will be experiencing. So this particular small sentence tells the reader he has to take care of his chastisement. He'll have to consider continuing care or whatever, the management of his chastisement. So the very sentence, the tense tells what is to be done and what is expected of the reader. Okay, now simple super sentence syntax. Past, now, future. I'll be just explaining all the details in simple present tense, in contrast to which you'll be able to understand the other forms as I'm teaching. I may not be explaining every detail over there because it takes a lot of time. And for example, he likes ice cream. Okay, let's see the syntax. He likes ice cream. That is simple present tense, which means he likes you. He liked it in the past. He likes it now. He likes it even in the near future. So he likes ice cream. It's called a subject, verb, object. If you remember the basic sentence structure I taught you, subject, he likes, verb, and ice cream is object. But in all the Indian languages, it is not as VO order, subject, verb, object. It is always subject, object, verb. So it will be transferred. For example, Malayalam, Avanu Madhura Palaharam Ishtama. Avan is subject, Madhura Palaharam is object, Ishtamana is verb. So in Malayalam, SVO is transferred into SOV, the syntax. And in Kannada, Avanige, Sihitindi, Ishta. Avanige, Avanu, subject, Sihitindi, object, Ishta is like verb. So again, SOV order in Kannada. Or else if you go to Tulu, Ayeg, Chipetindi, Ishta. Ayeg, subject, Chipetindi, object, and Ishta is verb. So you take any language, Tamil, Telugu, Hindi, whatever the Indian languages, the sentence structure is different. That's the main difficulty or challenge that we face in fluency, because we think in our mother tongue, we call it L1 influence, mother tongue influence. We think in Malayalam or Kannada or Tulu or Tamil or Telugu. Then in the process, when you have to speak out, you have to change the structure of the sentence. SOV has to be changed into SVO. He likes ice cream. Otherwise, for example, if you ask some small kids who are just learning English, ask them, Avane Madhura Palaharam Ishtaman. If you ask them to translate it into Avane he Ishtaman. Avane Madhura Palaharam. No, sweets. He sweets likes. So in the same order, they will repeat. He sweets likes. Subject, object, verb. But in English, it has to be changed over and it has to be subject, verb, object. He likes ice cream. So basic syntax, you should be very thorough with. So he is subject, likes verb, ice cream object. Third person singular. He is third person singular. First person is I. First person singular, I, plural, we. Second person singular, you, plural, you. Third person singular, he, she, it. And plural is we, they, all those things. So this is third person singular. That's why we have S with the verb. Like it like becomes likes. So the timeline, as I said, the present tense expresses a habit or often repeated action. Adverse verbs of frequency such as often, seldom, sometimes, never, etc. is used with this tense. Let's see. He goes to work every day. See here, go, ES is added. Goes to work every day. They always eat lunch together. They eat lunch together. There is no S with the E, T, because it's third person, plural. It's not singular. So what happens? Coming to this area, third person, singular, and verb, ES is added. Third person, plural, S is not added to the verb. Yes. And adverbs of frequency. What is adverbs of frequency? There is a scale being used here. Just understand what is scale, you know. Always I have been explaining. Always, That's why I said these are things are 7 Sapta Sutras, 7 principles are required in all the 4 sub-tests. Even in writing, when you use, you must be able to use the scale. Adverbs of frequencies, always, often, then coming down sometimes, seldom, and at last, never. So you see the scale coming. Always means not often, often means not sometimes, sometimes it's not, seldom, seldom means not never. So the scale, from the top to bottom, it becomes just contrast, the opposite. So this is the whole process. And simple present tense, as I said, verb will simple present tense, third person singular will go with it with the verb s or es will be added depending on the verb format. Mr. James experiences chest tightness. She goes. Go becomes goes to work every day. Yes. Now coming to present progressive. I hope present tense is very simple. It's very easy, and it's called simple present, and it's very simple. So use of present progressive, using the present continuous or progressive, whatever call it. So for example, someone is doing, he is making, he is coming. Okay. So the format will be, structure will be as somebody has posted in the Facebook. You have all the form formats over there. Have or has been, and ing form of the verb. Ing form means doing, making, working, swimming. Ing form of the verb. Has or have. And been has to be used. Yes. Now, use of present progressive tense. How do we use? Am, is, are plus ing form. He is walking. I am walking. We are walking. Ing form is here. Means right now he is walking. Right now it's happening. Okay. He is walking. He maybe started walking earlier, but still he is walking. He is continuing his walk. That is present progressive. The action is progressive. And use of present progressive. Past, he started here walking and he is walking now. He continues to walk. That is, she is walking. He is running. She is walking means continues to walk. Yes. Use of present progressive. What is the focus when you use it in OET? On the present action without relating it to the past. There is no connection to the past when you use present progressive. Use is referral and used in this referral and discharge letters. Purpose to communicate a piece of information which has occurred recently. Something that has occurred recently in the life of the patient is being communicated using present progressive. And something new that wasn't occurring before, in contrast to the present perfect, that wasn't occurring before. So you'll have to include even in the known cases, there'll be new news to the person whom you are communicating to. Though you are sending to the same community center or same rehabilitation center, you have to mention it because it's a new news to the reader. Something new that wasn't occurring before, in contrast to the present perfect, which I'll tell you. Something new that wasn't occurring before, which the medical practitioner will have to respond to or take into account in an active manner. The reader to whom you are writing the letter will have to consider it very seriously and take necessary action. That you need not tell them you have to take necessary action, because when you use present progressive, says the reader's attention is advised here or requested here. The very tense speaks. So using present progressive, for example, in your writing letter, how can you use it? Okay, one example could be the patient's condition is deteriorating, or the patient is refusing to take her medication. Now the skill used is contrast. It wasn't deteriorating earlier, but it is deteriorating now. It was stable, but now it is deteriorating. And patient was taking her or his medication earlier, but now he refuses to take. The skill of contrast is being used here. Communication. What do you want to communicate with this using the present progressive tense? The situation in the present is different from the situation in the past. Very fact you are using a present progressive tense, a sentence, it tells the reader that the situation has changed. There's a contrast. There's a drastic change or a change, mild change or whatever, a change that requires your attention. So without telling them it's important, it tells them you need to put your attention over here. So what does it mean? The patient's condition is deteriorating means in the past, the patient's condition was not deteriorating, but now it is deteriorating. It means, okay, this simple sentence means that. And the patient is refusing to take her medication means in the past, the patient was not refusing to take her medication, but now she means refusing to take her medication. So this particular present progressive tense provides some sort of distinction from or potential contrast to a previous situation. The situation now is not same as the previous, maybe when the patient was admitted or earlier. Okay, there is a change. So the progressive tense will tell you there is a change. Please take note of the change and do the necessary or render the necessary service. Okay, disassociation from the past is what makes it unique in its relevance to the present. It doesn't associate to the past, present progressive. There is no connection to the past, or it is a contrast to the past. Hope it is very clear. It's beautiful. The tense is really beautiful. Once you understand that, you know which particular area of the case is bar, you have to use which particular tense, then you can easily construct without even thinking what is to be written there, because you know the structure, sentence structure of each tense. Again, use of present progressive tense when describing an event currently happening. Okay, when describing an event currently happening. For example, Mr. James is experiencing chest tightness, experiencing right now, currently experiencing. Now going to use present perfect, the next type of sentence or tense. Okay, using the present perfect, has done, has made, has come. He has done, he has made, he has come. Used in the elements of the using present perfect, used to connect. Sorry, there is an extra, don't worry. Used to connect a past action or state to the present. Why present perfect is used? As I said, it is a contrast to the previous present progressive. In the present progressive, there is no relation with the past. There is a just contrast. Okay, dissimilarity, disassociation with the past. But here there is a clear relation to the past. Used to connect a past action or state to the present state. Okay, used in the elements of the situation. For example, although the action or state began in the past, they are linked to the present. The situation of the patient or something that happens to the patient started in the past, but it is linked to the present. There is an influence on the present, or it's still having its influence. The intention is to link a past event to the present, or to show its continued relevance to the current moment, whereby the reader will have to take care of it. Okay. So here, do not use a specific time phrase such as 2 weeks ago or yesterday. When you use present perfect tense, I have seen many of your letters, you say in the present perfect when you use time phrases like 2 weeks ago, yesterday, or 2 months ago. Please don't use it. You can use, I'll tell you what are the time expressions you can use. This is because the intention of the writer is not to communicate this information as a background. This is not communicated as a background. This is relevant now, as on now. Okay, using present perfect. Where to use the present perfect in your OET letter? To present more recent treatment or advice the patient has received. The more recent treatment or advice the patient has received, or to present more recent actions or attitudes which have been associated with the patient. To present more recent actions or attitude which have been associated with the patient, looking at the case notes, which are the most recent treatment or medications or advices or actions or attitudes presented in the case note. Those case notes will have to be constructed into present perfect tense. As a result of their relevance to the present, may not carry a specific time marker. Since they are relevant to the present, connected to the present, and related to the present, still the patient is suffering. The time markers, specific time markers, will not be used. For example, I have prescribed the patient propranolol to help control his anxiety. I hope I am right in reading that. The patient has responded well to treatment. Okay, he has responded well. I have prescribed, he has responded. Have and has is another challenge many of you face. Even in a communication, when you discuss, even otherwise majority, maybe that's the maximum mistakes you make is regarding use of have and has, which I'll be explaining soon. Okay, What is the purpose of using present perfect? To communicate that there has been no change in terms of relevancy from the past to the present in these cases. These aspects has a relevance to the present. So there is no change. Though it was a situation in the past, it is still continuing. That's why we use the present perfect, clearly telling the reader, it's still, the patient is still suffering with certain problems, and you need to consider or take care of the aspect. So that is the purpose. And using present perfect. Clues in the case notes. Time phrases. These are the time phrases you can use. You cannot use since yesterday, since 2 months back. But in the case notes, if you have time phrases like for and since, there you have to use present perfect. These prepositions can be used to link past and present actions. For and since are the prepositions used to link past and present. And there are also concerns about prepositions, but in prepositions in itself should be a session. So I haven't taken it in detail here. We'll be dealing with it later because it's going to be very, very long. Okay. Yes. So, clue in the case notes where you have to use present perfect. If there is something called these prepositions are being used in the case note for and since, you know definitely what is the sentence structure, how we have to construct sentence using present perfect. Okay, example, the patient has received massage therapy for the last 5 months. For the last 5 months. The patient received them in the past and receives them up to now. Till now, he is receiving massage therapy. That's why we use present perfect. Yes. We also use present perfect for details which describe unresolved situations such as improvement or deterioration in the patient's condition. In the case note, if ever you find a word improvement or deterioration in the patient's condition, the sentence structure is definitely present perfect. So you know what tense is to be used and what is the tense structure. And for example, since his last visit, Mr. John's pain levels have reduced from an 8 to a 4. Since his last visit, Mr. John's pain levels have reduced from an 8 to a 4. See, and our articles, most of you have a challenge over there. You don't write the articles. And 8 is EIGHT. So, and it's not the what is written there, but how do you sound it or pronounce it is important. And 8 to a 4. 4 is FOUR. So article is 4. So you know how to describe unresolved situation. Since his last visit, Mr. John's pain levels have reduced. Okay. So to describe such situations, you have to use present perfect tense. Again, what else? Where else you can use present perfect? You know, if you correctly take down these things, clearly you practice this, understand this, and if the video is uploaded, watch it 2 or 3 times, construct the sentences accordingly. You will take it very easy through the case notes, and you know what to write where and how to write, what are the sentence structures to be used perfectly well. And this is going to be assessed, is going to be one of the major assessment criteria in your writing. So it's also used, present perfect tense is also used to describe ongoing chronic conditions. So if any chronic condition is mentioned in the case note, immediately you know you have to use the present perfect tense, and you know the sentence structure. Chronic conditions in the patient's medical background. You know, when you go to the medical background, what tense is to be used is present perfect. Then you have a chronic condition. For example, Mr. James has had hypertension for 10 years and diabetes since 2000. Hypertension and diabetes, chronic conditions. So you are using has, the present perfect. And has versus have is the issue that you have. We take note of this very seriously. I have, you have. He has, she has, it has. And we have, you have, they have, which means has, H-A-S, has is used only with the third person singular. Third person singular, he, she, it. As I said, the verb carries in the present tense, third person singular verb carries S or ES with the verb. So don't interchange. Don't say you has, we has, or don't say I has, or we has. Don't say he have, she have, it have. That's a common mistake I have seen in your speaking as well as writing. Be mindful of that. So using articles, as I said, an 8, a 4. An MP is right, but a member of parliament. MP means a member of parliament, but when you say MP, the short form, the abbreviation, you have to use he is an MP. Whereas when you use the full form, he is a member of parliament. Because when you say member, m, consonant sound is not vowel sound, it's consonant. So member, a member. Whereas when you see MP, EM, M means EM, so it is vowel sound. That's why you use an. Though the word spelling here M is consonant, the pronunciation, the sound is M, EM. So it is an MP. And university, U, A-E-I-O, you say U is vowel sound or letter that produces gives a vowel sound. But then here, an university, the sound is Y-O-O, university, Y-O-O. So an university is wrong. You cannot write because it begins with U. A university. Okay, that is right. This one, a hotel is right. An hotel is right. A hotel, an hotel. So H could be silent. There are options to you pronounce it both the ways. A hotel, I am pronouncing H, a hotel, which means a hotel. Whereas if I don't pronounce H, if it's silent, and hotel. So both are right. Just to identify that, it is the sound, the pronunciation that counts on articles. And historical monument, a historical monument. An historical monument, right? A historical monument. That is silent at the beginning, first one. That is pronounced in the second one. Both are correct, but the articles will change. Not very simple, very big thing, you need not bother, but then just for an idea. Where I said an 8 when using present perfect with diagnosed. With the diagnosis, when the condition is unstable, you have to use present perfect. Mr. James has been diagnosed with asthma and prescribed an inhaler. He will return to the outpatient clinic next month for a review of the inhaler's effectiveness. So the condition is unstable. In such situations, with the diagnosis, you have to use the present perfect tense. Asthma treatment is still being finalized. In James' case, it's not finalized. If the inhaler doesn't prove effective, then a different treatment will be considered. So it is unstable. Condition is unstable. In such situations, expressing or communicating such diagnosis, you have to use present perfect tense. When the condition will be news to the reader, as I said, even the previous sentence, when the reader already knows the patient, in known case, what you say, and so you are telling them something new. Okay, Mr. James was admitted to hospital 3 days ago. He's been diagnosed with unstable angina and requires your follow-up care. Here, the diagnosis is news to the reader and how they will be involved going forward in the forward ongoing care and management. This is going to influence. Yes, using present perfect again. Okay, use of the present perfect with the diagnosed. When the condition is unstable, I told you already. When the condition will be the news to the leader, and the timeline will be, we are going to the next one. Use of past simple tense. So the perfect is over. Next is past simple tense. See the timeline. This is present, this is future, this is past. So the past simple is used for something that happened in the past, already over. No connection to the present. Action starting and ending, action finishing in the past, no connection to the present. Simple past tense will be used. Action begins in the past, ends in the past. There is no connection to the present. Any situation. So use of past simple tense, useful in your referral and discharge letters to provide background information, ISBAR, background. When you construct sentences as regards the case notes given in the background as per the ISBAR, you will be using past simple tense to provide, there's a mistake, to provide, there is no provides, provide background information, which has been specifically linked to a past time period. You're giving a background information which is specifically linked to a past time period. It's not related to the present. Example, the patient first presented 2 months ago with a bowel complaint. Now, she displayed symptoms consistent with IBS. Using the past simple for backgrounds, but specifically I have made B highlighted, uppercase, capital, because I refer it to ISBA, because we are referring to something which occurred in the past. Okay, past simple tense is used for background when we are referring to something which occurred in the past. And clues in the case notes, time phrases, where you have to use past simple or simple past tense. So the clues in the case notes are these time phrases. When something is written 2 months ago or last week, the previous month, yesterday, any of such time phrases are used, there you have to use the past simple tense. If you take these things and these notes, what you are taking down now, and read into your case notes, definitely you will understand where to use what and which tense is to be used. As soon as you read the case notes, you know this is going to be in past simple tense. Yes, use of past tense when describing an event in the past. Mr. James experienced chest tightness, experienced in the past. Okay. Earlier we said experiences, that is different. Now it is experienced, already over, experienced in the past. When describing an event in the past which is already resolved, already it is settled, it is healed or recovered, nothing continuing. Okay. For example, Mrs. Catherine gave birth 5 weeks ago. Mrs. Catherine gave birth 5 weeks ago. The baby has arrived and there have been no postnatal complications from the birth. The baby has already arrived and there have been no postnatal complications from the birth. Already the delivery is over, everything is done with. So Mrs. Catherine gave birth 5 weeks ago. It's something that has started in the past and completed in the past. That is past tense, simple past tense. Use of simple past tense with diagnosis. Okay, how do you use? Mrs. Catherine was diagnosed with pneumonia and treated with antibiotics prior to discharge last week. Pneumonia is now resolved. Mrs. Catherine was diagnosed in the past with pneumonia and treated with antibiotics prior to discharge last week. She was diagnosed and treated, started and completed in the past. There is no connection to the present. Then fourth one, when the situation is ongoing but is stable. Okay, even if there is a situation or influence or connection to the present, but if it is stable, diabetes that is well managed with the medication, though it is continuing in the present, still you can use past tense because situation was diagnosed, treated, and it is stable with the medication. Okay. For example, Mrs. Catherine was diagnosed with diabetes in 2018, for which she takes regular medication. Okay, although this patient still has diabetes, the diagnosis is considered a complete event now that the condition is stabilized. Okay, when the condition is stable, you can use simple past tense. Okay, few more examples. Use of past tense. She was commenced on metformin. She was commenced on metformin is right, but there are mistakes you like this. She commenced with metformin is wrong. She was commenced on metformin is right. She commenced with metformin is wrong. She commenced on metformin is also wrong. Okay, not recommended such expression. Use of past tense. 3 units of packed blood cells was transfused. Okay, this is a long-lasting discussion in many platforms, and there are being strong things taught. 3 units of packed blood cells was transferred. Though packed blood cells is singular, 3, when you add 3 units, it's plural. That's why this cannot be was. 3 units of packed blood cells were transfused is the right expression. Okay, again, use of past tense was case notes. For details such as test results or vital signs, you have to use past tense, which were accurate at the time of the visit. The past tense is appropriate. The test results or the vital signs which were accurate at the time of the visit, the past tense is appropriate. Okay, whenever the test results or vital signs are mentioned in the case notes, be sure that you are supposed to write the sentence in past tense. Okay, example, on examination, the abdomen was tender on palpation. Okay, yes. So let's recap. Use present simple for something which is unchanging, likely to be true for a long time. Example, patient's profile. When you construct sentences on patient's profile, use present simple. And about past simple, for background information is bar B, you have to use a past simple tense. That, you know, in the first one is situation, inquiry, or introduction. Use present perfect for information which links the past to the present. Responses to the patient's condition which are consistent with the past, which doesn't have a specific time reference, or use a time reference with for or since. When there is not such a time reference is not used, present perfect has to be used. Information which links the past to the present. There is a connection from the past to the present when you use present perfect. Present continuous for current information which requires a present reaction or response. When you are using present continuous or present progressive, that the past current information which requires a present reaction or response, the reader need to respond to this particular situation. That's why I use this particular sentence, and is likely to be different to the past. Development in the patient's situation which are distinct from or different to the past. It's contrasting to the past situation. There is a difference. Yes, that is done.
Hello?
Hello, Father.
Yes, you are still there. You got your answer right? Has been?
Yes, Father.
Yeah,
As had
all these things are, yeah, all these things are clearly explained with all the details in these videos. I'll be posting that link in the main tab, this one, main group. You can verify if at all you want again. Yeah. Then Sash has got your answer, I believe. Difference between the, yes. Yes. Any other concerns? Otherwise, we'll stop. We'll meet tomorrow again. God bless you all.
Thank you, Father. Good night.
Yes. Good night. Good night.
God bless you too, Father.
Thank you, Father.
Yes. We'll meet tomorrow at 8:30 Indian time. Please post your own country timings when I post the link below it, okay? So that it helps others, newcomers. Thank you.
Thank you. Good night, Father.
Good night.